And between that 2 weeks and now, a lot of issues has happened here in Ashanti region. More especially the issues relating to the COVID-19 situation in Obuasi. As at today, 20th May, Ashanti region has recorded 886 COVID-19 cases with 7 deaths. We have a total of 30 health workers having COVID-19 in the region. All of them are doing very well. Out of the total of 43 districts in the Ashanti region, 25 districts and municipals have reported COVID-19 cases. We have new infections. However, the good news is that the new infections are going down in all the districts in the region, especially in Obuasi. The major challenge we had in Ashanti was the situation of Obuasi. As at now, Obuasi have reported 587 cases. Obuasi Municipal has recorded 381, and Obuasi East reported 206 cases. As at April 19th, there were only 9 cases in Obuasi. But between 21st to 27th, the cases went up to about 300 cases. That was less than 6 days. The index case that actually caused this situation was a case that died. He had been in the community close to 2 weeks and has been sick. Fortunately, he operates around the market area of the family. So after the case was confirmed, we had so many contacts from the market area and then other areas in Obuasi. So all their samples were taken. However, because of the challenges we were having with the lab, with the backlog, the cases that were taken from 19th to 27th, we had the results on the 8th to 13th. And that was the reason why all these cases were identified during that period, May. However, all of them were cases that we diagnosed in April. And we started with intensive enhanced surveillance, contact tracing, and then tried to emphasize the importance of working closely with the municipal assemblies and then the district assemblies to get the people to abide by the rules and regulations as far as safety protocols are concerned. So I must congratulate all of you, including the regional minister, the municipal, and then the district chief executive. They work so well. And as at now, the good news is that the new cases of infection in Obuasi has reduced. We will project it for you to see that it was only during the period of 19th April to 27th April that we had the upsurge of the cases. And since then, the number of cases have reduced in Obuasi. So all the interventions that needed to be done is to reinforce what we are already doing. Adhering to the protocols and guidelines as far as personal hygiene is concerned, the use of sanitizers, and more importantly, wearing of the face mask and the social distancing. That is the key. And once the people of Obuasi and then other areas adhere to the protocols very well, I don't think we'll have a lot of cases anymore. All those who were confirmed positive, those who were sick or have mild infections, were admitted to our our treatment center. And then those with no symptoms at all are being isolated in 4 of our isolation centers. The two of the isolation centers are in Obuasi, and we have two here in Kumasi, and all of them are doing very well. One major challenge that we have right now, and that we want all of you to help to address, is that of fear, stigma, and discrimination as far as people of Obuasi is concerned. As I keep on saying, if that's the way we will drive the agenda of COVID-19, with stigma, fear, and discrimination, we will not achieve any results. We had opportunity to talk to some members of the community, and even those who are operating in other towns, that anytime they go around and they say they are from Obuasi, then it becomes another issue. People don't want to sell to them and other things. So all of us should understand that we are fighting COVID-19. We are not fighting people. We are not fighting Ghanaians. It's through no fault of theirs that they have the infection. So as much as possible, in our communication, let us make sure that we don't create any situation that will breach confidentiality and also cause fear, panic, and stigmatization as far as our fight with COVID-19 is concerned. We want especially the media to be very circumspect in some of the issues so that they will know the questions to ask and questions not to ask. And I must take the opportunity to thank all of you who has meaningfully contributed to this situation. I must say that the situation in Kumasi is perhaps one of the good examples that we can have. Despite the fact that Kumasi and Accra started on the same level, as at now, when you look at Kumasi and what has happened, I must say that Kumasi Metro and then Greater Kumasi, they've done so well. In fact, if you look at the data, you realize that the infection rate in the Greater Kumasi is so low. That means that we need to congratulate them, because that means they are adhering to the protocols and guidelines and they are doing right thing. Whatsoever they are doing, what we will urge them to do is to try and then do it more and even intensify it, because the fight is not yet over. In our recent discussion with you, we told you that more males were involved than females. But the situation in Ashanti region is not same today, because now male is 49% and female is 51%. And as I keep on saying, it depends on your exposure. But the reason is that most probably most of the cases that were coming from Obuasi were from the market area. And for that reason, we know that most women are in the markets. Maybe that's the reason why we are having these differences. As at now, 139 confirmed cases tested negative after initial repeat test. That's the recovery. If we say recovery, we have a protocol and guidelines also guiding what we call recovery. In Ghana, under our protocols, when we say you've recovered, that means that after 14 days of infection, we will subject you to 2 tests within 24 hours, and all the 2 tests should prove negative. So that is the way we do the recovery. And because this is a very high standard, that's the reason why sometimes it gives the impression that the number of recoveries are low, because it's basically based on the efficiency of the laboratories. So if the laboratories are not giving us real-time data, then it gives that impression. However, in all, every epidemiologist will tell you that once you know the incubation period of the disease, so for instance, here the incubation period is 14 days. All that you need to do is to multiply 14 by 2, and you get 28. So if you get the infection after 28 days, it's expected that you will recover. However, we only need the lab to confirm this. But as far as epidemiology is concerned, in the way we do, as far as the viral conditions are concerned, you are recovered when you multiply your incubation period, that's 14 days by 2. So after 1 month of infection, it's expected that if you don't die, you will recover. Why do you have to recover even without treatment? The reason is also very simple. You are recovered because the immune system in you is fighting the infection. And once you have your immunity strong, definitely the infection will subside if you don't succumb to it. So that's one issue that you have to understand as far as the recoveries are concerned. Currently, we have 15 people on admission and 75 are in isolation. We have a cumulative contact list of 1,283. And as at now, we have 54 active contacts being followed up. We've taken a total of 49,988 samples in Ashanti region. Close to 50,000 samples. The routine sample is 1,335. The community screening, that is the enhanced surveillance, yielded 42,586. Then the travelers that we screened were 1,387. And then contacts of confirmed cases, 4,352. So far, that is the situation in Ashanti region. The good thing is that the rate of infection is going down. The number of new cases that we are having are not as many as that we recorded in April, comparing that of May. So that means that whatsoever we are doing it right. And that we should continue to do it and then adhere to the protocols and then the guidelines. And I believe that, God willing, we will overcome. As the health minister said, COVID-19 has come to stay. As I keep on saying, Spanish influenza, H1N1, came in 1918. It's still here. So nobody should assume that COVID-19 is going. It has come to stay. But what we keep on saying is that COVID-19 is evolving. We are learning new things. We are trying to develop vaccines and other things. And then the body itself has a system of fighting most of these viral diseases. But the safety protocols is what is well known. We've talked about the safety protocols, and anytime I talk, I want to re-emphasize the importance of the safety protocols. Hand washing with soap and water, use of sanitizer, social distancing, wearing of face mask. These are the basic protocols that will be observed all the time. Whether we are removing the restrictions or not, if we adhere by the safety protocols and then the standards, we can live with COVID-19. However, they need to redesign or reorganize the way we do things. We can go to church, but social distancing, hand washing with soap and water, wearing of face mask will still be mandatory. You can go to school, but all these protocols will have to. So how do we fit in these challenges vis-a-vis the way we want to return our society to normal? My comment is that we should hasten slowly and then introduce the measures or removal of the restrictions one at a time, and then measure the progress as we remove the restrictions. Because the progress or what data will tell us will inform us whether we are doing well or not. So we can remove restrictions, hasten slowly, but at the same time, there's no way that we can do this without social distancing, and then wearing of face mask, hand washing with soap and water, no hugging, no shaking, and all those things. Those protocols, that one, I must say that we don't have any choice, but we'll have to observe them. And then maybe do what we do differently. Let me talk about the adjoining districts. Obuasi East and its adjoining districts. The strategy is that of enhanced surveillance, active contact tracing, and then testing and then isolation. And that's what we are doing for almost all the districts. So I believe that in those districts, they are also doing it. It's only that they are not getting, most probably, the positive results. But that is what we are doing. Because the enhanced surveillance, routine surveillance, and all these activities are going on in every part in this country, not only in areas where we've identified cases at all. So Adansi Asokwa is sending cases. Adansi South are sending suspected cases, routine surveillance. But the news is that most of the samples, when they are positive, we don't hear about it. But it's still going on. It hasn't changed. One of the major challenges that the program has been confronted with. Sometimes you identify a positive case, you call, and that same person will say, oh no, I'm somewhere. In Obuasi cases, there are about 48 of them. You get in touch with them, but they claim that some of them said they are in Western region. Others. It's all because of the fear and then the stigma that's associated with it. So anytime somebody is diagnosed as positive, they don't want to own up and then support. So we can address some of these challenges if we reduce stigma and then the discrimination. Because anytime fear sets in, then the people become apprehensive and will not like to disclose their status, will not like to help us as far as getting them to the isolation centers are concerned. However, Obuasi, for instance, they've done so well. They've been able to get most of the people who tested positive. Though some few were lost to follow up, but most of them were identified and are being isolated and managed. So that's actually the challenge. It's one of the challenges. It's all over, not only in Kumasi or in Ashanti region. That's the challenge. So we should try as much as possible to address the fear, the stigma, and also give them psychosocial support. Because as I keep on saying, the way they will be managed or treated will determine whether the program will succeed or not. Because the moment they come back from the isolation center and the environment is not good enough, they won't send good message to the community. And it will make the fight very, very difficult. So it's the same way that I want the media also to be very circumspect when they are talking about the cases. We hear some people saying that, oh, if you believe that the disease is there, show us some of the people who are sick. We have standards and protocols as far as the medical fraud is concerned. We don't disclose identity of people who are sick or people who are afflicted by disease. So it's not right, it's unethical for anybody to say that we should expose those people who are sick or those who are dead for people to know that the disease is really there. Because as far as we want education and other things to go on, that is not the way we will use to educate people. So as far as the service is concerned, nobody is going to disclose anybody's status. If the person willingly feels that he wants to support the program by coming out to say that he wants to help by disclosing his status and other things, that is acceptable. But that is left to the individual to decide. It's not the health system or anybody who should come out and then expose people who have the condition. Because we call it unethical, and that will not conform to the medical standards that we already know. As I keep on saying, COVID-19 is also a disease condition. And the way we treat any other condition is the way we are going to manage the COVID-19 cases. So I don't think it will be right for anybody in this country to say that we would like to expose the people for people to know that the disease is really there. Because that will go against the existing healthcare protocols and standards that we have universally, not only in this country. I hope it's well understood. And for that reason, I want media also to take it up and then educate people. When people call on your phone or your station and then they are saying this question, this is what you should tell them. And that's part of the risk communication. What we do is that the date that you take your sample is the reference point. It's not the date that the laboratory will give you what? Results. So whenever the laboratory gives us a positive result, we refer it to the reference point. That is the date we take the sample. And that is what we use to draw what? The graph. So for instance, if for a period, let's assume that today we have 886 cases, and the lab gives us 400. This 400 expands from a period of maybe 1 month. So you won't say that the rate has increased by 50% one day. That is not the way to calculate it. The way to calculate it is that your reference point is not the date you get the results. Your reference point is the date you take what? The sample. And that is what you use to calculate. So if today Ghana comes out to say that we have maybe 10,000 cases, that doesn't mean that one day Ghana has increased by what, 10,000. You have to work back to the date that you took the sample. So please, you have to understand the system. And I'm happy that you brought up this issue because it's one area that a lot of people don't understand. And that's what happened to the people of Obuasi. Because within 3 days, we gave them what, 300 what? Results. But the 300 results was taken for a period. So we had to work back to the reference point, the date that we took the sample. And that is what you need to understand. So don't assume that if you get 1,000 samples, 1,000 results today, that means that Ghana has increased by 1,000. Your reference point is the date that you took what? The sample, not the date that you get the results. I hope it's well understood. Kumasi South, fortunately, UNICEF has supported us. They are bringing in equipment to make sure that we complete the public health reference lab in Kumasi. That's also the process has started. Kofanoche is doing part, and they are working together with Kumasi Center for Collaborative Research just to make sure that we reduce the workload at KCCR. So Kofanoche have started. In fact, the key to the success of this program is the lab. When the lab gives us the real-time results, then maybe you can take sample today, tomorrow you will get it, and your real time will be very close to the date that you took the sample. So the moment the date that you took the sample is so close to the date that you get your results, then you say that you have a very effective program in the sense that you take your sample today, tomorrow you get the results, and then you can take decision. But if we don't get the real-time results from the lab, you take sample today, you wait, and then you get a positive results in 2 weeks. By that time, a lot of things would have happened. And that's the reason why we want to strengthen the labs in such a way that we will get a real-time results.